let's continue. Okay, so we said that in all our cells we've got organelles inside the cells, and the fluid that we have there is the cytosol. We've got organelles, but we're not going to talk about the organelles now. We're interested because we're talking about fluids, so our topic is going to be on electrolytes. So we did say that the main intracellular cation is potassium. It's the main one, but there is also magnesium. Those are the two. The main one is potassium, the second abundant is magnesium. We also have the anions, phosphate, and we also have negatively charged proteins. That's inside the cell. On the outside of the cell, we have the main cation is sodium, and then the second abundant cation in the extracellular fluid is calcium. And then the most abundant anion outside is chloride ions. Chloride ions, and the second abundant is bicarb. Right? Very important, guys. You know, this series is gonna help us to understand not only fluids and how they move, and also the type of fluid to give in what clinical scenario, but it's also gonna help us to understand and interpret UNEs with understanding. So, for a cell to function, remember, there are so many chemical reactions that take place inside the cell which are vital for life. There are so many of them. There's ATP production inside there. There's protein synthesis inside there. There are so many things happening inside the cell. Packaging and manufacturing and packaging of proteins, different proteins which are vital for life. And remember, enzymes are proteins, so enzymes need to be produced and So we need to keep this environment. And I said that it's important for this cell to function normally. We need to create an environment where there's isotonicity across this cell membrane. So the concentration of all these solids outside should be the same as the concentration of all these solids inside the cell. We've spoken about that. Now, there are mechanisms that the body has come up with to make sure that we keep this intact. So, let's talk about sodium. Sodium is the most abundant extracellular fluid cation, and the body makes sure that in the extracellular fluid, sodium is always between 135 to 145 millimoles per liter, and inside in the intracellular fluid it's about 12 millimoles, right? And coming to potassium also, the body tries by all means to make sure that the potassium that is outside the cells in the extracellular fluid is about 3.5 to 5.5 at all times. Because once you have got abnormalities, we've spoken about hyperkalemia, hypokalemia, hypernatremia, and hyponatremia. And the potassium that is inside the cell is about 150. millimoles. Right? So, to make sure that, because these are the most important cations, so to make sure that there's no problems there, we keep the concentrations this way. There is a what is called a sodium potassium pump. Sodium potassium pump. The sodium potassium pump is a channel. It makes sure that it pumps potassium inside the cell to make sure that potassium outside the cell remains in this concentration. So it pumps potassium inside the cell, and when it pumps potassium inside the cell, it also pumps sodium outside of the cell, right? It pumps potassium from the extracellular into the intracellular, and at the same time it pumps sodium from the intracellular to the extracellular, just to make sure that we keep these two concentrations. And this pump is called the sodium potassium ATPase or pump. Right? Very important pump. Without this pump, we would have abnormalities of those two cations, and would have, like I said, when you have got abnormalities here, you get cardiac complications. Here it's mainly your CNS manifestations, right? So remember, we have learned from school that when you are going to pump solutes against their concentration gradient, you are going to need energy. You're going to need ATP. It's an active transport. So when you are pumping potassium from the outside to the inside, you are pumping it against its concentration gradient, because we know that potassium is more abundant inside than outside. So you're going to need energy for that. Even the same applies when it comes to sodium. When you're going to pump sodium into the extracellular where it's more abundant, you are going to need energy for that. So that's why they call it the sodium potassium ATPase pump. So yeah, now guys, these sodium is very, very crucial. It's the main determining factor in terms of how water moves here. When you've got sodium abnormalities, you are going to have movement of water. You're going to have a shift of fluid from one compartment to another. So that's why when you've got a patient who's got hyponatremia, when they've got hyponatremia, you want to know what is their volume status. In any case, hyponatremia is classified according to volume status of the patient, because once you have lost fluids, there's going to be a change in your potassium, and also once you have lost potassium, there's going to be a change in your fluid. That's the relationship that they have. So you can't talk about fluids without talking about sodium. A dehydrated patient, you want to know what is their UNE status, right? Now guys, let me bring in some clinical insight here. Say now, okay, when I have a patient and I say to myself, okay, according to the history, I want to do this patient's UNEs. Maybe this patient has got dehydration, or maybe I'm preparing the patient for theater, or has been vomiting, whatever indication I have to do UNEs. So if I do UNEs, what I'm doing there, remember, when you draw blood, this is a vessel, this is a cell, this is a cell, this is a cell. So when you draw blood, you are taking plasma. right? So the values that I gave you, this 135 to 145 of sodium, this 3.5 to 5.5 of potassium, is the plasma. It's in the plasma. But we know that there's a constant movement of water from the interstitial space into the intravascular because of those pressures, your hydrostatic and your oncotic. So if I take a sample in the intravascular space, it also gives me an idea of what is happening in the interstitial space or in the extracellular fluid compartment. It gives me an idea. So, and if I know what is happening here, I roughly also know what is also happening inside there, basically. But if I take a plasma a sample, it gives me a reading or an idea of what is happening in the interstitial space, right? So when I take my blood, I want my sodium to be between 135 to 145. That is normal. As much as, even though, like I'm saying, even though the sample that I'm taking is in the intravascular, but the reading that I get here tells me, it gives me an idea what is happening in the interstitial space as well, because of that exchange that occurs, the shifting of fluids between those compartments. So it's going to tell me about the sodium, and then the potassium, I want it to be 3.5 to 5.5, right? And my chloride ions, I want them to be between 96 to 106, some say 102. So obviously these will vary from lab to lab, but they are more or less the same. What another thing that the UN is going to tell me is the bicarb. So it's going to tell me, so a normal bicarb is about 23 to about 29, right, millimoles. So these are my UNEs. I'm not going to talk about the urea and the creatinine in this video because that's not what we are discussing. We are going to talk about that when we talk about glomerular filtration, renal failure, that kind of a thing. But for now, let's keep it here. So these are the things that I'll get from my UNE. If now I'm interested in what is happening with the calcium, what is happening with the magnesium, what is happening with the phosphate, because remember, you do have magnesium outside the cell, but it's less abundant. You do have. So the same electrolytes that are outside, you also have them inside, but it's all about which electrolyte is abundant in what fluid compartment, right? Okay. Now, if you say, I also want to know the calcium, magnesium, phosphate, you do a different test. It's called the CMP. C is calcium, M is magnesium, and P is phosphate, right? Now, calcium is 2.15 to 2.50. That's calcium. 2.15 to 2.50. Okay, let me just do it this way. The CMP. But the CMP doesn't really tell you about the fluid status of the patient, huh? Okay, so calcium is in the plasma is about 2.15 to 2.50, and your magnesium is 0.63 to 1.63 to about 1.05, and then the phosphate is 0.75 to 0.75 to about 1.42. So these are the plasma values of all these electrolytes. I mean, it's very nice, you understand. I mean, the abnormalities, this can be high or low or normal, 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 high, low or normal, and all of that. And now you need to take, this is when now you need to understand, okay, if I'm having hypercalcemia or hypocalcemia, what is happening? If I've got hyperphosphatemia or what is happening. So, but we're not gonna get into those. Maybe later on we're gonna get to that. Maybe later in there, I'm not sure, but we'll see. But this is what I want you guys to grasp right now. So if you take a blood sample, a plasma, it gives you an idea what is happening in the interstitial. So it's like, if you know what is happening here, you also know what is happening here, right? If you get hyponatremia, you know that there's hyponatremia also in the extracellular fluid. If you have hypo or hypernatremia or hypocalcemia, whatever abnormality that you have here, you also know that you also have it here, basically. That's the point I'm trying to drive, right? So guys, let's cut this video and we'll continue on the, that's gonna be part 3, I think. Thank you.